Hi, I'm Dr. Stan Winokur. For the past 30 years, I've been taking care of, talking to, and listening to cancer patients. Today, I'm privileged to have the opportunity to do this with Mayor Rudy Giuliani. Rudy, it's a pleasure for you to share your story with us.
It's an honor to be with you.
Well, thank you. Let's get started. The first thing is you look fantastic, so tell me how you're feeling.
Well, thank you for asking, but I feel great. I've been free of cancer now about five years, and I get tested every 6 months now, and my PSA is virtually zero. So every time you go back, you kind of relive it. You know, you forget about it. Right now, I got tested about a month ago, so I'm not thinking about it. But 5 months from now, when I have to go back, there'll be one night where you think about it, and then when you get the good news the next day, you feel, well, thank God.
Yeah. Take me back in time. What was it like? Tell me when you first found out.
Sure.
How did that happen?
Well, I went for just a physical, and not because of any particular symptoms. I just hadn't had a physical in a long time, so I went for a physical. And as part of the physical, the doctor, who's basically an internist, took a PSA test, and then he called me up a day or two later and said, "It's a little high. We've got to get it tested again." And so I went to see a urologist at that point, and the urologist said, "I'm going to give you Cipro for some period of time, maybe it was a week, to see if it's an infection. And if the PSA is up, then we'll have to do a biopsy." So I went through all that. I didn't really give it much thought. I got the biopsy. I was sitting in my office as the mayor then, and my doctor called, and he said, "The test came back, and it's positive." I said, "Thank you." I said, "Thanks. Well, that's great." I'm about to hang up the phone because, I'm very busy. I had like 10 other appointments that day and 3 speeches. And as I was about to hang up the phone, I pulled it back and I said, "Wait a second, Alex. You said that funny, because positive to you is negative to me." He said, "Right. You have cancer." The test that came back showed that some of the sample that had been taken showed cancer. I got up the next morning, I got the newspapers out, and I looked at the front page of the Daily News. Front page of the Daily News said, "Mayor has cancer." So I said, "I'm going to take a look at the Post. Let me see what they say." The Post said, "Mayor has cancer." And I'd say for about 2 or 3 days, it really hit me. My father died of prostate cancer. I started thinking about what it was like for him when he did. I got to the point where I realized I was very lucky. I said to myself, I'm feeling really bad for myself right now. I'm feeling like I'm at a lot of risk and in great danger. And that a day before I wasn't. I was really healthy a day before. Had tremendous energy. I could work 20 hours a day. I said, actually, I was in more danger before I found out. The time I was in real danger was yesterday, when I didn't know about it. Now, I can do something about it. And I'm a very lucky man that I got a warning about something that could kill me, because some people don't get that warning. And that changed my whole attitude. That sort of thought that my wife helped me with and some other people sort of gave me a much different attitude toward how to handle the whole thing. That I was, look, you can't control the things that happen to you, but if you get a warning about it, now you're put in a position where you can do something positive.
You've described your reaction. I'm interested in finding out, how did you decide on which treatment you were going to get when you were confronted with all this?
I made a mistake. I don't recommend what I did to other people. In fact, when I recommend to other people, I tell them to narrow this a little bit. But I ended up, maybe because it was so public, maybe because I was the mayor at the time, I went to like 12, 13 doctors. And they got a point where it kind of started confusing me, which is too many. I finally ended up, after that journey, back with my original doctor, who was Alex Kirschenbaum, who's a terrific urologist. And when we sat down, Alex said, "Look, tell you what we'll do. You tell me who you've been to, and and we'll make a chart, and I will tell you what they recommended."
He knew.
So we did. We went, doctor this one, doctor that one, doctor this one, doctor that one, doctor this one, and he got it all right. And then I decided on seeds, implantation of seeds, and external radiation, and hormone therapy to shrink the size of a Lupron to shrink the size of the prostate. But none of it was beyond the ability to be able to maintain what was a pretty, what I would call a normal work schedule. My work schedule before that was abnormal. My work schedule before that was 14, 15 hours a day. But I was able to work 9 hours a day and then have to take a nap during when I was going through it, most of the time.
So how did the experience that you have with cancer compare with 911? Any parallels or anything that you could use?
There was a feeling that I had right after September 11 happened that it was good that I had gone through cancer. It's strange to say it that way, when I was going through it, you don't feel that way. Then a year later, it was about a year later, having gone through that helped me deal with mortality, helped deal with my own. Up until the time I had cancer, I may have been one of those people that, thought you were immortal. I never took sickness very seriously, and I was very fortunate not to have had any kind of major illnesses. And it made me confront my own mortality. It made me understand the value of life, health, what it means to get a warning like I did. And then right after September 11, when I saw so many people that had been killed and so many that were friends of mine and got to know so many of the families, I really felt like a very fortunate man because I said, look, these people didn't get a chance. They didn't get any kind of warning. I mean, they're just in that building and all of a sudden they were attacked or somebody gets a heart attack and they die. I was a very fortunate person because I got the PSA test warned me. And so I've become a very big believer and supporter of, you got to get examinations, you got to get tested, try to get early warning signs. These are things that you shouldn't be afraid to know. These are things you should want to know because they really help you.
I'm ready to fight my cancer.
I'm ready to begin chemotherapy.
I really am ready because I'm going to take Neulasta right from the start to help protect me from infection.
Chemotherapy can reduce your white blood cell count and increase your risk of infection, which could put your treatment on hold. But Neulasta is a white blood cell booster that can help restore your white blood cell count to reduce your risk of infection. And with a sufficient white blood cell count, your doctor may have a better chance of giving you your chemo on schedule, which doctors agree is the first step to success. Neulasta is for most cancer patients receiving strong chemotherapy. In rare cases, splenic rupture or serious allergic reactions have been reported. Report abdominal or shoulder pain or any allergic reaction to your doctor immediately. The most common side effect of this injection is mild to moderate bone pain.
I'm ready to start.
I'm ready to fight.
I'm ready, thanks to Neulasta.
Ask your doctor about Neulasta and how you can be ready for chemotherapy.